Some say it's a change for the better, more privacy at your local pharmacy.
And more opportunity to reduce medical errors at the drugstore. Fox 13 medical reporter Maria Black has details in today's Health Matters.
The Tennessee State Board of Pharmacy is requiring that all drugstores add a private place to counsel patients on prescription drug use. It's a fairly new regulation designed to cut down on errors and improve the quality of care for patients. Pharmacist Charles Champion has been dispensing prescription medicines and herbal remedies to Memphians for more than 40 years.
What happens is that
And he says counseling, or at least offering to counsel his many customers about their medications, is a built-in part of his personal service.
We also do a printout here on our computer for each prescription with information. Now, if they don't understand that information, they can call me anytime and we will discuss that, what's on there. Now, what else you need?
He says patients have lots of questions about their medications, so he has a room already set aside where they can talk to him privately.
They should have knowledge of the medication, contraindications, anything that they should look forward to, in the treatment.
The new regulation stipulates that pharmacies shall provide a consultation area which offers sufficient privacy to the patient. It's a law that's been on the Tennessee State Board of Pharmacy books for a year and a half, but will now be enforced beginning January 1st of 2000. Dr. Champion says pharmacy care should include something he calls the brown bag concept. That's where he tells his patients who are taking several different types of medication to put them in a paper bag and then bring them to him so that he can look them over and give his advice.
They'll have the same thing from 2 or 3 different doctors that they are taking, and possibly more than one drugstore is involved. And that is the reason why I try to stress pharmaceutical care.
Personal care that Dr. Champion says is good common sense, and the state of Tennessee now says is the law. Now, pharmacists that don't comply will be penalized $100 and drugstores will be fined $500 for the first offense. And Stephen Laurier, I spoke with someone from the Tennessee Board of Pharmacy, and they told me that if all the pharmacists comply with this ruling, that they could cut down the number of errors maybe by as much as 50%.
Wow.
So maybe it's worth putting it into action and making sure everyone complies.
Okay. Thanks very much, Maria.